Welcome to Up to the Minute. I'm Todd Duplantis. Thank you for joining us. It is, of course, Monday, or it's actually Tuesday, April the 7th, and we are moving along in this month. It seemed like January lasted forever, according to Brittany, and then February, it's lasted, it didn't seem like it ended. March went by extremely slow. Now we're into April, Brittany, and how's this month moving for you?
I think I saw it best on social media the other day. It's like, congratulations, you made it to the fourth level of Jumanji, and
Yeah.
that is April, because there's just there's been so much going on since 2020 began, and I don't know how what the rest of the year is going to have in store for us.
I'll have to just wait and see. Hopefully, it will keep getting better as the year moves along. Dr. Phillip Nicotera joins us this morning. Doctor is the president of HCC Coleman College of Health Sciences. We are very pleased to have you on, Dr. Nicotera. How are you doing this morning?
Great, Todd. How are you doing? And hi to Brittany.
We are, we're making it through. Things are
Right.
getting better each day. It seems like we're adjusting to at least the life as is right now. It's not always going to be this way. But the reason we're all here in this environment is because of COVID-19 and the fact that everybody's at home trying to self-isolate and quarantine ourselves to keep from the spread of this virus. Dr. Nicotera, we've heard a lot of rumors about this virus, but what makes this different? I mean, years ago we had H1N1, we've had SARS, but we didn't have a shutdown like this. What makes
Right.
this virus unique?
Well, so at the beginning, so this is the same family of virus of SARS. So we do know information about coronaviruses. It's a family of viruses. What's making this one difficult is how it attacks the lower respiratory system. And I'm kind of going so there's a lot of unknowns about it. So what we learned about SARS, we're unable to apply to the coronavirus 19 here. So I'm going to kind of liken this to a saying that we hear a lot, is that we're building the plane as we fly it. So as we're learning more about this virus, as we see more and more patients, and so in the beginning we thought, that it was just attacking, or the worst symptoms were coming in the elderly. As time went on, that expanded to all populations or all age groups. What's different about this is that we don't know a lot about it. We're still looking for treatment options. We're still trying to create a vaccine, and vaccines are slow to come about. So that's I think where we stand is the unknown.
One of the major concerns, I guess, for locking everything down is not that everyone was going to get sick, but that people were going to get sick in mass amounts and we were going to be flooding the hospitals. What are the challenges for the medical community nationwide, but really specifically here in Houston?
Right. Well, yeah, I think here in Houston, in which I think will be as much as the same as in the rest of the country, we're fortunate in Houston that we have a very, very large healthcare system in Houston. So we have many facilities, we have many physicians, we have many healthcare workers. So I think that's an advantage to the Houston community here. With the Texas Medical Center and all the facilities there, is something that will help us as the cases increase in the Houston area. But the challenges are just like challenges that we see in the other parts of the country, and that's the availability of the PPE, or protective personal protective equipment. Challenges of equipment. I think one of the other challenges that perhaps is not rising to the forefront right now is, I think, it's going to be the fatigue of the healthcare workers, as well as potentially healthcare workers also getting ill and decreasing the number of healthcare workers that will be available. I haven't seen much of that in the news yet or moving forward, but I do think over time that will happen. And I can see that as being a very large challenge. I think some of the other challenges are in testing. Lots of people getting tested, maybe more people should get tested. The inability to get the tests out quick enough is another challenge. So, but I do think as time goes on, our biggest challenge is going to be in the workforce.
You, of course, are training your staff and Coleman College, training the workforce, answering to the demands of the healthcare industry. How is this, and this has been a constant question popping up in our social media, how is the online learning affecting people who have to go in and serve in the hospitals as part of their coursework? So how is this affecting the education of students at Coleman?
Yeah, great question. It certainly has been something that we as HCC and Coleman administration, along with the faculty, have had to figure out in a very, very short period of time. So, fact number one is, as time went on, as the virus began to expand into the Houston region, we saw that healthcare facilities were asking students not to come and get trained there any longer. So we saw that over about a 2, maybe 3 week period. By the end of the 3 weeks, we were unable to have clinical rotations anywhere in Houston. So we're completely affected by that. So students are unable to get their clinical. So speaking to that, we know that, and so our plan is to just have students not do that part of their education right now. We will eventually get back into the healthcare facilities, and so we will make those students a priority to complete their clinical rotation. One of the other things that we're doing is, along with San Jacinto College and Lone Star College, the Chancellor Maldonado, has a plan that we would go to the county judge at some point and ask for waiver for high demand positions so that we could get into doing our hands-on sooner than perhaps other types of programs. We have not gone down that road. It is a plan, and we will go down there. We certainly are looking to make sure that those that are in the programs that are missing portions of their clinicals, that they will complete. So my advice to them is to just hang in there and we'll get clinicals done. Secondly, we monitor almost every day our third-party accreditation, meaning those accrediting bodies that provide standards for our program. And so they are looking at, they understand the situation of what's going on with clinical. And so we are monitoring how they're going to, if they're going to reduce perhaps the number of clinical hours that we can do, or offer some flexible options for us to do that. Back about a week ago, the governor of Texas came out with a plan from the Board of Nursing that we could do our clinical using greater than 50% simulation. So that's something that we have already integrated into our nursing program. So we started classes on March 30th. Our faculty worked very hard and long hours to redesign the curriculum. And then secondly, to find resources in which we could do simulated clinicals online for our nursing program. So we started doing that already in nursing. However, some of the other accrediting bodies have not gone down that road yet, but we're hoping that they will, and that will help us. We have put online some hands-on exercises for students to continue to do that so that they can continue their education. So maybe
this is it's very unprecedented what's happening, and you kind of mentioned it earlier and alluded to the fact that we're building this plane as we're flying it.
Right.
and we all kind of are learning as we go along. But it seems to me, I'm more interested because you guys are looking at going to the county judge and asking for a waiver to get the students back in there. It would seem to me, hearing that our medical staff around the Houston area and the nation are very tired at this time and they're getting overworked,
Right.
that they would welcome some new workers in there, because I know a lot of your students work a lot of times on the jobs that they eventually will be getting hired at. So it seems like they'd be wanting them in there. Wow.
Yes, you're absolutely right. So we have, it's kind of the double-edged sword, Todd, where, at one point, you're right, we need to replenish the current workforce. But on the other hand, we want to keep our students and the population safe. So where's the happy medium with that? Now I had read recently a plan by a hospital system out in Long Island, New York, that for clinicals, their plan was to allow students to come back into clinicals in areas in the hospital which had minimal or no contact with any patient that is symptomatic of COVID-19, so that they can continue that pipeline of students completing their clinicals and graduating out. I did make that known to our administration, so perhaps we can share that with the county judge at the right moment.
Dr. Nicotera, how do you see this affecting the healthcare practice once we get out of COVID-19? How do you see it affecting first us and the healthcare? Because are we going to be shutting down the nation every time a new strain of the flu comes out?
Well, we've had flus around forever since the beginning of time. I think we'll be back to normal flus like we've always had. Unfortunately, the research isn't out there enough on the COVID-19 for us to really understand what happened here. But I do think the normal routine of infectious diseases and influenzas will occur just like they've always occurred. This is an anomalous situation. So I think we might become more vigilant. I think that we may, one of the things that might come out of this is us being able to prepare vaccines and much quicker than our normal process. We're a little bit slow in that, and some of that is due to federal regulation. There for a good reason, but perhaps we can streamline that so that we can get vaccines out sooner. The second part of your question is one, I think the whole world in some ways is going to change, the whole workforce because of this, because I think we're learning how we can do business in a different way. We're doing education. I mean, we've always had online education has been around for a long time, but now it's really, really out there. So I think, in terms of education, we'll be looking at how can we distribute education in an online, but also in a face-to-face mode, and I think more of that will happen. But in terms of healthcare, I think that one of the major changes that I think we will see, just as a normal patient, is I think we're going to. This is the advent of telemedicine. Telemedicine has been around. It has never been embraced. It has, it hasn't really been reimbursed well for physicians to want to do that. There's reluctance by physicians to not be able to touch and feel a patient. But in many cases, telemedicine is a very positive way of seeing your patient. So I think we're going to see more of that happening. So I'll give you an example. If you think about it, 40 years ago, a physician didn't have the sophisticated tools that they have today to diagnose patients. So they had to rely on what they could see, the questions they could ask, knowledge that they had learned over time with patients. And so with telemedicine, you have to go back into that way of looking at your patient that you were 40 years ago. The other thing that I heard, and I was listening to actually a radio show where one of the physicians from NYU likened this to, if you think back, and I don't know how long it's been, but it's certainly been many years. I can remember it as a kid when your doctor did house calls.
Yeah, yeah.
I mean, there are a couple of services out there that do that. Now, but back then it was just common practice. And so this physician was talking. It's kind of like doing a house call doing telemedicine. You get to really evaluate your patient in their home environment, and that maybe gives you a more holistic picture of how to treat your patient. So, I really think that we're going to see telemedicine come to the forefront. We're going to see more physicians now that have had to do it, and they're going to embrace it. So if you think about it, your average physician can't see patients. So your family doc or your or any physician, even your specialist, and really can't see you. So the only way that you can have an appointment is to do telemedicine. So physicians, now are doing that normally would never ever consider doing telemedicine, so that they can keep their practice going and they can continue to treat their patients. So, in my opinion, that's one of the big changes that will come out of this for medicine and for the patient. And then just one other quick thing, this will, some patients, you think about it, Texas Medical Center, patients come here, they get their treatment, and then they come back and forth for follow-up visits. Many of them drive miles to come back for follow-up visits, when follow-up visits really can be done through telemedicine.
Yeah, yeah. I mean, a lot of them will come from out of state, and now they don't have to leave their state. Dangerous. One quick question: do you see, when you do have those face-to-face appointments with your doctors and interaction, do you see the use of PPE more prevalent from now going out? Because I can't remember, only a few cases where I'd see a doctor wear it in the office. Yeah. But do you think that's going to be a standard, at least now, for the next 12 months?
Yeah, for the next 12 months, I would think so. I think after, and this is just my personal opinion, I think we're just human, and then perhaps after 12 months, we'll become more comfortable and go back to the norm. But I think you're right. The next 12 months, I think we'll see much more caution. Yeah.
Dr. Phillip Nicotera, the president of Coleman College, thanks for joining us here on Up to the Minute and giving our folks an update on what you guys are doing at Coleman and what's going on with this disease. We really do appreciate you being here on the show this morning.
You're welcome. Appreciate it.
And now I'm going to go to Brittany Pacheco, who is joining us once again from her parents' house. Brittany, how's it going out there?
Hey, good morning, Todd. It's going well. Yep, I'm live here from my parents' house.
So I wanted to ask you, we had Dr. Nicotera on. Were you getting any questions on social media? Because he did address a lot of the questions that popped up about what's going on at Coleman, how do I do my clinicals, and he was able to address those for things that our students have been asking.
Yeah, that's incredibly helpful. And thank you, Dr. Nicotera, for being on with us today. We have had several Coleman students who did inquire about the clinicals, and we did get some clarification from the college about that. But also, a lot of the deadlines have been extended for these different program areas. Can you talk a little bit about what those deadlines are now going to look like, and does anything change at this point?
Yeah, right. So that's a great question. Thanks, Brittany. Number one is that, many of the programs for admissions require the HESI entrance testing or admission testing. So we're working on a plan for that. We had been notified by the HESI maker that HESI admission test can be taken online. So we'll be sending out a communication very shortly to the applicants that they can take the HESI online. And so that will continue. We right now we have our deadlines are in June for many of the programs. The nursing deadline had passed on April, but for those who didn't do the HESI, they're going to get the opportunity to take the HESI still. So we're not ruling them out in any means. In terms of all of the other programs, dental hygiene is another program that their deadline has passed. Those students that put in their application prior to the deadline, who have not taken the HESI, will be able to take the HESI and be considered for the class. Now, the other programs, their deadlines are in June, so we have not extended those as of yet. Doesn't mean that we won't. We're going to have to see when we can get the word out for the HESI and monitor that. So if we need to extend that a few weeks, that would not be out of the realm of possibilities. But as it stands for the other programs that enroll for the fall, we're still working on those deadlines. Some of the programs that require observation in the field, we've waived that for this time because obviously you can't get into a healthcare facility to do that observation. And one of those was the dental hygiene program, and I think PTA or physical therapy assisting was the other one, and occupational therapy assisting is the other one. But yes, that we will be sending out. We're finalizing with the HESI maker, getting the information for how that can be done and how that can be taken online. Hopefully that's
Dr. Nicotera.
Question. I think a lot of potential candidates out there are interested in that. So hopefully that word reaches them. We just were able to find that out yesterday, or get to that point. So we met about that yesterday. Just to let everybody know, we meet several times a day to determine and to make decisions how we're moving forward. So as we mentioned before, in this period of time where we're doing things that we've never done before, building the plane as we fly it, some of these things are happening. So we just ask for patience. Anyone that has put in an application, we're going to send you some level of some type of communication, most likely by email of how to take the HESI and what's happening.
That's really great information, Dr. Nicotera.
It sounds like with many of our students, all of them have unique situations. They really do, and Coleman is doing the same thing that a lot of our colleges are doing, is reaching out to those students. So if you haven't heard from us yet, you're going to. Dr. Nicotera, I'm sure you could speak for this, that we're not going to leave the students hanging. We're going to get back to them. And a lot of times their questions are individualized, which you guys have to look at individually and have someone answer them, correct?
Yeah. And if I can, students that are currently enrolled in the program. So we have set up where we're operating remotely, but we're operating business as usual. So a student can call the office, their program office, and somebody, they can email. Probably email might be the best way of doing it, but they can call as well. Because if they call, we will answer either that phone call or that email, and we'll get back very quickly if we're unavailable just at that moment to answer that question. So business is operating as usual. So students that are in the program can call. Students that are in admissions, they can call, our student services office or email questions in, but we will be contacting them. We definitely know if you've applied, we're going to give you the direction of where we're going with the HESI and when you can take it, or answer other questions as needed.
Well, thank you. Brittany, any other questions you got coming out from students right now? Looks like we lost your microphone, Brittany, if you want to turn it back on.
Thanks, Todd.
There you go.
Yes, Todd. So yesterday we announced that we were moving our summer registration from Monday to tomorrow, which is April the 8th. And there's still a couple of questions coming in about the method of the instruction. And students, yes, summer classes will be offered 100% online. So the kind of situation that we're in right now for spring 2020 is the same situation we're going to look at or be in rather for summer 2020. We don't have an answer about fall. I know we did have one question come in last night about fall, but we're just kind of taking this day by day, one step at a time. We are following the guidelines by the CDC as well as our federal, state, and local officials. Once we've been given the all clear to resume our normal daily lives, and that means returning to work and to physical buildings, including HCC, we'll make that decision.
Right.
I'm glad you brought that up. I also wanted to mention that we made an announcement yesterday about graduation. Graduation will be taking place online May the 22nd, virtually. It'll be a virtual graduation. Students will be recognized, so everyone can get a chance to watch and participate in this online ceremony. But another commencement is happening in the fall. In December of 2020, and we will allow all of our students who didn't get a chance to walk in the spring to walk in the fall. There's been a few students out there in social media who've had a problem with this, and we do encourage you to go to the graduation page, and you can email the administration through graduation. We have a graduation committee, and we take all of the suggestions to heart, and they want to see your comments and suggestions. So if you have something you'd like us to see, you can send it to us on social media, or you can email the administration through the graduation website. There's an email on there as well. Dr. Nicotera, one final thing before you do go, and we talked about this briefly. The CDC just came out with a guideline, suggestion more or less, for all of us to possibly go out in public with masks we fashion at home. What's your take on this?
Well, I'm not going to go against the CDC. They're much smarter than I am, and there's a lot more brains there than I have. So it will give you some level of protection. It won't give you maximum protection, but again, I think the most important piece of that, it gives you peace of mind, but without a doubt, the most important thing that you can do is the social distancing.
Absolutely.
Whether you wear a mask or not is a personal decision. I'm going to be going out, and I think I'm not going out today, but I think I'm going to go out tomorrow. I've got to go to the supermarket. I'm probably going to throw out a mask. So I would encourage people to do that if they have that opportunity, if they have a mask or they can fashion something to do that. It does offer some level of protection. Not 100% protection are you going to get out of the mask, but social distancing is the way to go. The more that you can do that, the less crowded places that you can go into. Looking at all of that is the way to go.
Dr. Phillip Nicotera, thank you for being here. And if you have a question for Dr. Nicotera, you can comment below. He is going to be joining us for an episode of The Topic, which we'll be recording this afternoon, and we will post it tomorrow. So if we didn't get to your question during this live stream, post it below and watch the recorded version, and we'll get it answered for you this afternoon. Thank you for being here again, Dr. Nicotera.
I appreciate it, Todd. Thanks for having me.
And Brittany, thank you for joining us from your parents' house. We'll see you tomorrow for another episode of the show.
Yeah, I'm thinking about maybe doing the show with my mask on. What do y'all think?
Yeah. I like the mask, but let's save that for public. You're a little isolated in the room, so you're fine in there. But I like the mask. That's a homemade one?
This is a homemade custom from my mom, who's a seamstress. She's making one for every member in the family. So it's nice to have someone who can do it for you.
Give her my compliments. That looks professional. That's great.
Thank you. I will certainly tell her.
Could you make a few extra for the folks on the show today? Maybe Dr. Nicotera and myself. You can send over a couple.
Absolutely.
We'll have to do that. Yep.
All right, Brittany, thank you for joining us, and thank you for being here today. We will see you tomorrow at 10 a.m. And this afternoon, we have a show with James Mabel, the Director of Career and Job Placement Services. And also, we'll be talking with Coleman staffer Jana Weiss, Program Director of Student Life. They will be joining us at 1 o'clock today for the afternoon edition Up to the Minute. We'll see you later on.
Great. Thanks.
Thank you.